Pain is inevitable. Suffering is optional. Haruki Murakami. With medical students holding the patient steady and onlookers gathered with eager anticipation, Scottish surgeon Robert Liston prepared to begin. He swiftly made the incision, sliced through the patient's skin, and began sawing through bone. In just minutes, the amputation was complete. In the 1830s, Liston earned fame for his incredible surgical speed. This wasn't just a spectacle, it was a necessity. Before anesthesia, patients had to endure every agonizing moment of surgery fully conscious. The faster the procedure, the higher their chances of survival. The quest for effective anesthesia began long before Liston's time. As early as 200 CE, Chinese physician Hua Tuo experimented with mixing alcohol and herbal powders to ease pain. By the 13th century, Arab surgeons like Ibn al-Quff were using sponges soaked in opium and mandrake to sedate patients. By the late 1700s, scientific advancements brought new possibilities. Chemists began exploring the medical potential of substances like nitrous oxide, ether, and chloroform. In 1799, English chemist Humphrey Davy experimented with nitrous oxide, famously inhaling it himself and sharing it with friends. He noted its pain-relieving properties and suggested its use in surgery. However, this idea took decades to gain traction. Meanwhile, in Japan, Seishū Hanaoka successfully used a herbal anesthetic to perform a mastectomy in 1804. Despite its success, the technique was not widely adopted outside Japan. Around the same time, ether gained attention, first as a recreational substance at ether frolics, and later as a potential surgical tool. In 1842, American physician Crawford Long performed a tumor removal using ether on a patient. Dentists also began exploring nitrous oxide, despite an early public mishap in 1845 when a patient screamed during a tooth extraction. It was likely due to an insufficient dose, but it cast doubt on the drug's effectiveness. In 1846, ether had its breakthrough moment. An American dentist administered it during a tumor removal surgery. The patient regained consciousness shortly after, claiming he felt no pain. This success caught the attention of surgeons like Robert Liston, who used ether for an amputation 2 months later. Ether was revolutionary but had its downsides. Its strong odor and unpleasant side effects led researchers to seek alternatives. Scottish obstetrician James Simpson discovered chloroform in 1847. After testing it himself, he used it during childbirth. It became popular for its quick effect, though its risks were not yet fully understood. As anesthetics gained acceptance, ethical issues arose. Some doctors used sexist and racist beliefs to deny certain patients adequate pain relief. Charles Meigs, an American obstetrician, argued that the pain of childbirth was a divine experience. Similarly, James Marion Sims performed experimental surgeries on enslaved black women without anesthesia, despite its availability. By the late 19th century, anesthetics transformed surgery. Complex procedures became possible and patient outcomes improved. However, the risks of chloroform led to its decline by the early 1900s. Nitrous oxide and ether remained in use, with safer formulations emerging over time. Today, anesthesia allows surgeries to be conducted without the excruciating pain of the past. Speed is no longer the defining skill of a surgeon. Instead, precision and care are the priorities, turning what was once a nightmare into a dreamlike experience. For more videos, please like and subscribe.